Hi, Miss Roddy. My name's Courtney. I'm going to be your occupational therapist today. From your chart, I saw that you had a distal radius fracture on your left wrist 8 weeks ago, and you were immobilized in a cast. Is that right? Okay, so after the cast came off, you've been having some difficulty extending your wrist up, and that's giving you a hard time performing activities like preparing meals, eating, putting in your earrings, and typing at school. Okay, so to help with this, I would like to use neuromuscular electrical stimulation. And what this entails is putting these two sticky pads on your forearm, and it's going to work with the machine and some electricity to help elicit a muscle contraction, and you're going to work with that to gain back some of the range of motion. And you can also take this home so that you can perform it at home.
Okay.
So like I said, a benefit is that it will help you gain back the range of motion so that you can easier do some of those tasks. And a risk is that it could just cause a skin irritation, but a little redness is normal and it should dissipate within a half hour.
Okay.
Does this sound like something you want to do today?
Sure.
All right, so before I get started, I just have to ask you a couple of questions. Do you have a pacemaker? Any internal stimulators, like a bladder stimulator? Are you pregnant?
Nope.
Any seizures, history of seizures? Peripheral vascular disease? Clotting?
Nope.
Cancer?
Nope.
Any infection? Okay, and are you on any medications?
Nope.
Can you tell me where you are right now?
University of St. Augustine.
Okay, and then I just want to inspect the skin. So we're going to be putting the pad in this area, and your skin looks healthy there. And I'm just going to test the sensation with the other side. So you can close your eyes, and I'm just going to be putting my finger over here. I want you to let me know when you feel it.
Feel it.
Okay, and does it feel the same?
Mm-hmm.
Okay, and do you feel that?
Yep.
And does it feel the same?
Yep.
Okay, do you feel that?
Yep.
And does it feel the same?
Yep.
Okay, you can open your eyes. So before I put the electrodes on, I'm just going to get the unit set up. So I said we're going to be using the neuromuscular, so that's EMS, and we're going to set that at S. So you're going to use the mode button to do that. Okay. And then you're going to set the ramp time at 2 seconds, and that's how long it's going to take for the muscle to fully contract up to full extension. And then we're going to do the on time, which is how long it's going to be contracting. So we'll do that for 10 seconds. And the off time for 30, so it's a 1-to-3 ratio. The rate we're going to set at 35 hertz, and the width for 250. Okay. And then we're going to use this waveform button down here, and we want to set that at asymmetrical for small muscles. And the time, we're going to do 15 minutes here, but at home you can do 30 minutes.
Okay.
So before we put the pads on, you just want to clean the area. So can I have you bring your wrist up as far as you can? Okay, and you can see the bulk of the muscle belly is right there. So we're just going to make sure that we clean off that area and below. And on the bulk of the muscle belly, we want to put the black wire and make sure the wires are pointing parallel with the muscle belly, so we kind of want them pointing down towards your wrist. And we're going to put the second pad, at least the pads width apart, below it.
Okay.
And also you want that wire pointing towards your wrist. Okay, so before I start it, once it begins, you're going to feel a tingling sensation, but ultimately we want you to feel a strong but comfortable muscle contraction. So I'm going to start increasing, and I want you to let me know when you're feeling that, okay?
Feel it.
Okay. So once it starts to extend, I want you to extend your wrist with it, and we're going to do a feeding task during.
Yep.
So you can just bring it up.
Just turn it down.
Wait. Is that comfortable?
Yeah.
Okay.
So just wait.
Yeah. Once it contracts, then you can bring it up. Okay, so I'm just going to walk away and work with another patient and leave you this call bell. If it feels anything less than strong but comfortable, please ring it and let me know.
Okay.
All right, so it's been 15 minutes, so we are going to stop the activity. And when you're at home, before you turn it off, just make sure that you bring the intensity all the way down.
Okay.
Okay, and you're not feeling anything anymore, right? Okay, and then you can power it off. Okay, and then once you take off the electrode pads, you just want to inspect your skin and make sure that you didn't have any type of adverse reaction. But a little redness is normal, and that will go away. And when you're at home, I want you to do this 1 to 2 times a day for 30 minutes, Monday, Wednesday, and Friday.
Okay.
All right, thank you.
You.